I would be with patients caring for them in the clinical setting. And then I would think, man, this is so frustrating. I have 10 minutes that I need to rush through my visit with them and meet these certain requirements. And I can't even dive deeper into lifestyle, nutrition, other factors impacting and impeding them from achieving the results and the relief that they deserve. And in my mind, I'm like, there's got to be a better way. There has to be a better way and a better approach to this, especially since so many people truly want the help. They want that guidance. But with our conventional approach, it's so restricted and limited. So fast forward about a year into working as an NP, and I came across another nurse practitioner who started her own online practice in functional medicine. And that really sparked my interest. I'm like, okay, here we go. This could be something.
Welcome to Nursing Beyond the Bedside. I'm Audrey, your host, and a nurse who pivoted my path several years ago. After 8 years as a critical care nurse, I was ready for change. I craved higher pay and more flexibility, but was struggling to find a clear path forward. Fast forward through positions in recruiting, customer success, and marketing, and many lessons learned along the way. Today, I run Pivot Path, a company dedicated to empowering nurses to redefine their careers. This podcast is designed to help you navigate the journey from clinical bedside nursing to a fulfilling career that aligns with your passions and goals. Here, you'll discover inspiring stories from nurses who've gone beyond the bedside, successfully transitioning to non-clinical roles, or redefining their nursing career. Join us as we hear their stories and share actionable strategies to help you make your own leap. Whether you're a new listener curious about what lies beyond the bedside, or a returning audience member in need of some fresh motivation, this podcast is your go-to resource for exploring new opportunities that can transform your career. Let's get started. Today, I'm happy to welcome Rachel Montero, a board-certified nurse practitioner and functional health consultant specializing in gut health. After struggling with her own health issues in her early 20s, Rachel found relief through a holistic approach that focused on addressing the root causes of her gut problems. This experience led her to create her own business, Wholeness and Health, where she now helps clients achieve better health by bridging the gap between traditional and functional care. In this episode, Rachel shares her journey of leaving bedside nursing and building her business by leaning into her existing skills and knowledge. Rachel, welcome to the show.
Thank you so much. Thank you so much for having me.
Yeah, absolutely. I'm excited to dive into this conversation today because your journey has taken a very personal path, triggered by your own personal experiences. So I'll let you kind of choose where you want to dive in, but how did this all begin for you?
Yes. So, as a little background, I became an RN. I was just 20 years old. And it was at this season of my life, too, in my early 20s, where I started dealing with a lot of gut issues. And not only gut issues, but also symptoms that didn't necessarily seem normal, but I didn't know how to address them in my traditional background. And while working as an RN, I very much was taught the traditional approach with medications. And behind the scenes, I was very active, exercised, ate what I thought was a healthy diet, um, remained up on top of my health lab testing and everything as much as I could proactively. And I just kind of pushed through for a long time while working as an RN. And of course, as many nurses listening know that an RN job is very high stress, very intense pressure, lots of adrenaline. And I didn't realize how it was impacting my body either, especially as a new nurse learning the ropes of working on a medical surgical unit to start with. And well, I did go to a very strong nursing school and nursing program, and I felt confident graduating. It's a whole new world once you're on your own as an RN, and it is very intimidating, and you tend to get pushed off sooner than you feel ready, per se, to be on your own. And I didn't realize how that was impacting my health, and I didn't know how to support my body optimally or help to manage the stressors going on. It was just kind of that go, go, go mentality, just push through, work a 12-hour day, come home, eat dinner, go to bed, and do the same thing again. And then my days off, I was exhausted and would just want to like lay low at home or maybe meet up with a friend, and wasn't really aware of how my nervous system was also being impacted by this either, and how to properly support myself while working such a high stress, high adrenaline job. So fast forward several years, my gut symptoms kept progressing. I'd be at work and I would have terrible stomach pains out of the blue. I would have to either hide in an empty patient room or go to the bathroom and stay there for a period of time until it settled down. Or I would have terrible bloating, terrible gas, stomach pains, unpredictable bowels, you name it. I was really just struggling with what was really going on here. And also, furthermore, I was dealing with a lot of acne breakouts in my life. This was the most I've dealt with acne in my life. I never really had issues with my skin either or my gut. So I started to try different diet plans. I cut out so many different foods. I was gluten-free, dairy-free, monitoring my macros, low calorie, low carb, low fat, you name it. All of the diet plans that they recommend or that you can find on Google search outside of what I really knew. And nutrition isn't something we really learn in nursing school either in terms of an optimal approach to nutrition. And I was feeling frustrated and also felt guilty because I felt like as a healthcare professional, I should know better, quote unquote. And I felt like I should know how to tackle what was going on. And even going to my doctor, they're like, okay, well, your labs are normal. You seem healthy overall. I guess just keep trying to try different diet plans or maybe try some probiotics or some other supplements, see what happens. And it's frustrating. And it starts to feel like you're crazy for dealing with these symptoms. So
Mhm.
I eventually came across a functional health consultant on Instagram. What she was saying really spoke to my heart and really resonated with me in these underlying symptoms that can be signaling something much deeper going on. And I'm like, you know what? What do I have to lose? I ended up saying yes to work with her, and it completely changed the trajectory of my life moving forward, both personally and with my career. And she really opened my eyes to a whole new world of digging much deeper than we typically do in the traditional world of conventional medicine. And we go beyond just the symptoms, beyond just the medication as a treatment, or beyond, okay, here's your diagnosis such as IBS, quote unquote, take this medication and send you on your way. It's okay, why are these symptoms really happening? What's really going on here? And what's leading up to them to begin with? And it goes even deeper than food, deeper than dieting, and looking at all aspects with that holistic perspective too of all factors impacting your day-to-day lifestyle, what's going on in your mind, how you are navigating stressors in life, different toxins we're exposed to, our environment, and even our mindset towards health, towards food can become a stressor in itself. And we can develop an unhealthy approach towards health, which was definitely me. It became an obsession as a way to try to cope with what was happening and try to take control of what I couldn't control. And so I went on this lifelong journey or long-term journey. It is a lifelong journey as well in terms of continuing to support your body in this way. And that completely transformed my health, and it certainly didn't resolve overnight. However, it allowed me to feel validated in what I was experiencing and to learn a new approach that I did not learn as an RN. And I eventually went on to my master's and became a family nurse practitioner as well. And same thing there, diagnosis, medication treatment as a treatment, and then quick visits with patients and very limited time with them versus with the person who I worked with, the functional health consultant. It was much more in depth in terms of she really got to know who I was as a person. There were no time constraints, and it was a journey that we went on together. And it was really beautiful to be heard and understood in that way by another professional, but also someone who could actually take the time to really guide me in a way that I really needed at that point and not be restricted.
Had you already been through this experience with the functional health coach prior to becoming an NP?
Yes. So before becoming, it was just about as I was, it was kind of a little bit of both interlapping. I was working with the functional health consultant before starting my master's, and then also while going through that process too, because I did not yet know at the time, which is something we'll definitely dive into, how I could actually take my nursing background and turn it into a different path with starting my own business and not need to necessarily pursue the traditional path as a nurse practitioner.
Yeah, that's interesting because kind of simultaneously you were having this experience with the functional health consultant where you were feeling very like seen and heard as a patient versus like in your nurse practitioner world feeling like pushed for time with your patients. So you're really like experiencing that dichotomy all at once, which I think is interesting.
Yes, absolutely.
I also, you said something that caught my ear because it is true and it's actually not something that I thought about that much until recently. But nutrition, when it comes to the education of clinicians, medical professionals, like I think I had an elective course on nutrition in college, but it was like kind of a blip on the radar as far as like my overall curriculum went. And
Mhm.
I have just now that I've like kind of realized that in retrospect, I'm like, wow, nutrition is such a significant part of our overall health that it is like a little bit mind blowing to me that it's not more of a focus within our curriculum.
Yes, truly, yes. And it saddens me honestly to think about because as you said, it's a such plays such a profound role on our health and how our body functions. And our typical approach is to focus on eliminating foods rather than adding in nourishing foods that really allow your body to thrive. And as you experienced, it was just a blip of some brief info on nutrition in my nursing
Yeah.
program. And outside of that, it was all self-taught. Everything that I did and learned regarding nutrition was completely outside of my traditional nursing program. I went through a functional health nutrition certification as well, and I learned so much in that experience alone. And I wish all nurses were trained and practitioners were trained in this way too, of how to properly utilize food as medicine, essentially.
Hmm. Yeah, absolutely. I know we're so focused on the pharmaceutical fix rather
Yes.
than like the root cause and like how we got there and what lifestyle things can change. How long did you remain a like practicing as a nurse practitioner before you kind of had that light bulb moment of I can build my own business around this?
Yes, it really wasn't too long. I even when I was in my clinicals, it was about a year that I worked as an NP, and but even during my clinical experience, I feel like my experience was were preparing me for where I am today with my business. And I would be with patients caring for them in the clinical setting, and then I would think, man, this is so frustrating. I have 10 minutes that I need to rush through my visit with them and meet these certain requirements. And I can't even dive deeper into lifestyle, nutrition, other factors impacting and impeding them from achieving the results and the relief that they deserve. And in my mind, I'm like, there's got to be a better way. There has to be a better way and a better approach to this, especially since so many people truly want the help. They want that guidance. But with our conventional approach, it's so restricted and limited. So, fast forward about a year into working as an NP, I was looking more online into other options and other avenues where I could go. And I came across another nurse practitioner who started her own online practice in functional medicine. And that really sparked my interest. I'm like, okay, okay, here we go. This could be something. And I followed her content for a while and engaged and spoke with her. I also reached out to some other NPs who, after researching a lot, I would find the people who were doing exactly what I wanted to do or something very similar in that vision that I had in my mind. So I would connect with them, ask them, where did you start? How did you start doing this? And gradually take baby steps, one step at a time, towards just starting my own online business. And completely letting go of the bedside rule, completely letting go of the traditional setting as a nurse practitioner, and just going all in with serving women online.
That's incredible. And I think it's really cool that you found others who were doing something like the same or similar that you could reach out to and learn from. I
Yeah.
think that honestly, like that can kind of be hard for entrepreneurs because I think that a lot of time there can be a little bit of a knee-jerk reaction of like, oh man, like someone else is already doing what I want to do. Like that's a bummer. I guess I can't do it. I think
Right.
that can be one reaction, whereas the other reaction that you took is like, great. Like this is proof of concept. Like people are out here doing this and being successful with it. Like what can I learn from them? So I think that that is the best way to approach it cuz you know, you also just don't know like who out there is going to connect with you more as like the person to provide that like service to them. So I think it's really important to have that variety and not let seeing other people out there, doing what you want to do deter you from going after it.
Yes, it's seeing what is actually possible rather than, "Oh, I should shy away," because they're already doing it. Yes.
Exactly. Okay, so let's talk a little bit about like what that experience was like making the actual decision to leave nursing. I mean, you had put in all of the time and effort to go to grad school and you were practicing and, how mentally was that for you? Like what barriers do you feel like you had to overcome internally in order to make that pivot?
Yes, it was definitely a lot of different barriers that popped up, and it was during different phases of the process, essentially, in terms of the specific barrier itself. In the very beginning, it was more, I was just excited about what was possible. So I didn't necessarily let the limiting beliefs stop me or take over. I think it was a new type of adrenaline of like, oh my goodness, I'm so excited about this, and let's go, let's pursue this. And I'm very much someone who I'm self-driven, and when I see something that like I want to do that, I will go for it. However, as I kept taking more steps toward this and working behind the scenes while continuing to work as a nurse to maintain my income while growing my business. But then as time went on, I was thinking, man, should I actually fully let go of my nursing career or leave the traditional setting altogether? And my background as well before working as an NP was working primarily bedside for roughly 8 years as a nurse in the hospital setting. And we already know there's so many nursing shortages as it is. So you feel that guilt of, oh man, am I leaving other nurses hanging? Or you feel that guilt of further not supporting the shortage. But of course, if you leave the bedside, it's just going to continue to, there's just more and more of a shortage happening, and you're not supporting that further by doing
Mhm.
this. So then it's that contradicting thought of, okay, maybe I should just do a little bit of both. But then in my heart, I knew, I'm like, you know what? This isn't what in my heart I feel like I need to pursue more is supporting women in this new way, and that my own struggles has led to a greater purpose of helping other women who have dealt with these same struggles with these gut issues as well, and helping them to transform their life as a result of that too. It goes so much deeper, and it's not about me either. It's about other people who really need a new type of support that simply traditional
Mhm.
medicine just doesn't fill that gap. And there's so many wonderful things, certainly, about the conventional approach to healthcare that there are aspects that are truly life changing. However, when it comes to certain aspects of our health, we really need to dig deep and get to the root cause. And this is where I knew, okay, this is the gap I know I need to fill. And I worked years as a nurse and then a nurse practitioner. And then now it's my time for a new season. And it's okay to let that grow and to move forward into this next step.
Yeah, I'm really actually glad that you tied it up in a bow that way because that's how I ended up coming to feel about my pivot away from the bedside as well. I think that guilt that you expressed feeling is something that is like very common
Mhm.
among nurses. Like we take that on ourselves when
Yes.
we think about going and doing something different. And like I felt the same way. Like I did finally come to peace of like, I spent 8 years working in the bedside and that was a solid 8 years. I did a lot of good. I touched a
Mhm.
lot of lives during that 8 years. And I can feel comfortable like leaving that chapter and moving on to something else where I can. It sounds just like you. Like you're kind of chasing your passion and you're
Yeah.
still making an impact, but you're making an impact in a way that feels very like personal and important to you.
Yeah.
And that's what I've found talking to so many nurses on this podcast is we're a very passionate people as
Mhm.
nurses.
Yes.
And I think that it's been really cool to learn about all of the different places that can take us and the impact, all of the different ways that we can make an impact if we do just kind of follow that passion. So I'm
Yes.
glad that you mentioned that because I think that that is kind of a common sentiment.
Yes, absolutely. And it's using that passion to help fuel us. And we are caregivers as well. And it's natural for us to want to help other people. And then sometimes the consequence can be it's hard to also leave a setting where it's already struggling in the sense that there's already a lack of staff.
Yeah.
But at the same time, as you said, it's not on us. It's not
Hmm.
our burden to carry. And
Right.
we're not meant to hold on to that burden ourselves.
Yeah, could not agree more. A few minutes ago, you mentioned how you kind of really dove deep into learning more and more about functional medicine. How did you feel when you were leaving your nurse practitioner like practice behind? And then you knew that this is where you were headed. How did you feel about overcoming that like did you feel like there was a large gap there that you needed to fill with new knowledge? Or how did you feel like the basis that you already had helped give you like the foundation that you needed to get that extra bit to fill in that gap?
Yes. So I definitely felt with my nursing background alone, I had a very strong understanding of the human body and also with the hands on experience with many, many patients navigating many complex situations. I knew that no matter what, I could figure it out or at least seek the right support to help me figure it out if I was feeling stuck. Just as an RN, we're never alone at the bedside. If a patient is coding, we can always call for help. Same with this role. Sometimes we can feel a little bit lonely, per se, as business owners working online. However, there are so many other people like yourself who are out there supporting other healthcare professionals in this way too that we can seek guidance from. And that is what I did, a little bit of both. I honed in on my prior knowledge and experience as a nurse as a great foundation and my experience as well to help boost my confidence of what I was truly capable of. And then also further seeking guidance from other professionals in the more functional medicine world who had years of experience already in this approach to help train me, to teach me, and to learn. And I'm continuing to learn how to further support other people using this approach as well. And then just tying it all together. And it's a very unique thing that stands out as a nurse who pursues functional medicine because we have that unique background and experience with so many people that we cared for and were spent a lot of time with, and nothing can take away from that experience.
Yeah, absolutely. And so once you kind of like learned, and of course, it's every day you still learn, and whether that's in what you're practicing or just like the business side of things, being an entrepreneur is all about just a growth mindset and learning more every day. What are some key takeaways then from like some of your learnings and like your philosophy that the approach that you take with clients?
Yes. So, as far as a few key takeaways, oh, there are so many. I would say that one is to just simply have an approach where you're always open to learning something new and that perspective of that maybe even though it seems different or maybe it seems unique or not what you're accustomed to, it doesn't mean that it's not going to work. In fact, it can work even better. And we just need to be open to something that seems maybe that we're a little bit skeptical too, but in reality, it can actually lead to something even greater as a result of being open to this new thing or this new approach as well. That is one thing. And there are many things that I have learned and also guide my clients with where even from their perspective, they're thinking, okay, Rachel, are you sure? Are you sure this is going to work? And I'm like, I know it seems maybe a little bit crazy, but trust me on this. You got this. Just give it a try. And then they reap the benefit of it. And it's really interesting because sometimes too with the conventional approach in comparison, we can be stuck in our ways with that approach. And I feel like that's also a gap missing is that things haven't adapted with the conventional world. Certainly technologically wise, that has been advancing. However, when it comes to just learning the human body and doing it from a more holistic perspective rather than separate systems per se, because it's all connected. All of our systems are constantly working and in communication with one another. And still in our conventional world, we have different specialists for different organs and systems. And that piece of it is unfortunately broken because it leads to a lot of miscommunication and it leads to a lot of things being missed or not being addressed properly. So that's another side of this too, where that was a new thing that I did need to learn both personally and now in my experience in working with clients. But it's actually really, really beautiful when we do view it in this new way of viewing our body as a whole and helping to become more empowered over our health as a result. And then also being willing to just get uncomfortable. As a business owner, it will push you out of your comfort zone in so many ways. And oh my goodness, your mind will try to stop you. Your mind will try to say, "Oh no, don't do this. This is scary. This is a change." Your mind will really try to take over, ultimately to try to protect you because anything that is different is intimidating to your body. It loves comfort and routine. So it's really when you can continuously remind yourself it's okay to branch out of my comfort zone while also having guidance in the process, someone who can mentor you is a beautiful piece of that as well to really help you through those roadblocks.
Hmm. Yeah, absolutely. And, you also mentioned how like personal of approach you get to take with your patients, which I think is really important too, because like I think I actually used the word algorithm to describe like what I did as like an ER nurse at one point. It was like, okay, like you come in with X, we do Y and Z, and you're good to go, you know? And
Yes.
so I think that the holistic approach and the personalized approach that you take is so important. And I think it's kind of obviously better if you just like think about it like conceptually. But I feel like that also must take a bit of a flip of a mindset coming from being a nurse to taking on this new approach because to your point, like you said, like the key is just having an open mind and, being open to new types of solutions because every single patient you work with, it just must be different. It's not like you're following like the same algorithm for every patient that you're working with in this new way.
Yes, exactly. And that was a big shift that I really did not learn in my degree, my nursing degree. And it was definitely a little bit of resistance there in terms of really opening up to this and then really just applying this in an effective way as well. It was definitely a learning curve of learning how to apply it uniquely to each person. And each person, as you said, is so unique in the factors impacting their symptoms and their health, which also needs to be honed in on. However, I ended up over time just seeing it as an incredible thing because I realized how incredible our bodies truly are and how unique our bodies truly are. And it's interesting because as I've worked with more and more women, yes, there are many different factors impacting their unique situation and symptoms. However, many of the core factors, especially the women that come to work with me, they often relate to me in certain ways. And sometimes they have gone through situations that I have gone through, like very similar situations. And I'm like, oh my goodness, this is crazy because I have gone through something very much like this. And then I can really deeply empathize with them and deeply connect with them in that way. And that is a beautiful piece of this that we can experience as much in the traditional setting because we just don't necessarily have that deep connection with all of our patients. And it's a little bit different when in this approach with having our own online business, many people are coming to you versus vice versa, meaning they are choosing you. They are choosing to work with you. And there is, as you work with them longer, you realize, okay, I see why they connected with me here, and I see the similarities here as well. And as you said, this is why we cannot let our minds take over in terms of, oh, this practitioner is already doing this. Why bother copying what she's doing? When in reality, there are very different people meant to work with her that are meant to work with you simply because of these
Exactly.
unique components, right?
Yes, absolutely. Do you think that there's a way for nurses who are still working at the bedside to start thinking more holistically and caring for their patients, from more of a functional health perspective within the confines of kind of like how our healthcare system works right now?
Yes. So, as far as opening up to this new approach, one thing to keep in mind is that it doesn't mean that we are completely disregarding anything we have learned or implemented in the conventional world of medicine. And it doesn't mean that we still don't apply that in some way. We're more so adding to that and adding to it in a way where we are viewing our body in a new way that is ultimately allowing us to help other people in even a more efficient way. And also, too, instead of, for example, because I spend a lot of my time as a nurse handing out medications and spending a lot of time navigating a lot of logistical things behind the scenes outside of my direct hands on care with my patient, yet that also took time away from allowing me to really get to know all aspects of the human because you're so focused on just these set tasks that you need to do during the day. And you only have so much time in a day, right? Versus when we open up our eyes to a more holistic approach and then have the time to be able to support our client more holistically, then that allows us to really support our clients in a new way that really lets them to be even more successful and is more empowering because we're no longer just saying, okay, here's a pill to mitigate this symptom, which still doesn't address the deeper root cause of what's going on. It's okay, here are some shifts that can be implemented in your day to day life that you have control over that will help you address these root causes to ultimately experience lasting relief.
With where you are now, do you think that having your background in nursing is crucial for the understanding that you have today?
I would say that my background in nursing has played a profound role. I honestly don't know where I would be had I not gone the route of becoming an RN. And I would say that it has allowed me to provide a unique approach and support patients and understand patients, especially those who are dealing with chronic illnesses or want to prevent chronic illnesses. Since as a nurse, you see it all, you see it from the beginning of the development of an illness to when patients are repeatedly back in the hospital because of flare ups or ongoing complications from their chronic illness. And because of this wide approach or wide perspective, I mean, when it comes to seeing kind of like the beginning to the end of an illness and its progression, I can apply that to my support with my clients. And I don't think I would have that per se knowledge or confidence to help them in this way without my nursing background. And it's something that stands out as well in our world today because nursing is such a trusted profession. And many clients that I work with do really appreciate that I have a background in nursing and they really see it as a positive thing because it's such a beautiful career and a trusted career. So it helps other people to put their trust in my hands that maybe otherwise wouldn't.
Yeah, definitely. I would think that too, as a like customer looking for help from somebody like you. I think that knowing that you're a nurse would be a huge value add because nurses are advocates. Like
Yeah.
nurses are like the people within the healthcare system that like you can kind of trust to like raise their voice for you, like and
Mm.
like really watch out for your best interest. So I
Yeah.
do think that's, just from a consumer perspective, I would see that as a huge perk.
Yes. Yes.
And so for if you are talking to nurses who are at the bedside right now, if they're listening today and they're maybe just feeling a little bit stuck, a little bit burnt out, kind of like wondering about different opportunities, whether that be entrepreneurial or otherwise, do you have any advice or key takeaways that you would pass along to them?
Yes, I would say to even just simply begin getting curious and connecting with other people who are doing something that just sparks your interest. And someone in the holistic realm, whether someone like myself or another healthcare professional who has pursued this path of holistic care and functional medicine, and just engaging in conversation with them, asking them questions about their own experiences and kind of their own pathway of how they ended up where they are. And that's also where I got recommendations as far as different programs to follow more professionally in terms of certifications and just enhancing our knowledge. And that led me to pursue the functional nutrition certification that I obtained and had a great experience. I would highly recommend that certification in particular, and also did further training with another functional medicine practitioner as well with more functional labs, which functional labs are incredible too. And I would just say to start putting yourself out there, start doing research in terms of holistic health in itself, and even listening to podcasts. I would listen to so many different podcasts on a daily basis, all about holistic health. And now there's so much out there about it that it is, I love that there's more awareness about this approach. And it's also great to listen to another conversation like this where you can just connect to them and just hear different aspects of this approach, and then start to think about your own life journey in terms of maybe your own health journey or different things that you've gone through personally or even witnessed in your experiences as a nurse that you might be drawn more so to when it comes to the holistic approach. And just start taking baby steps. You don't have to have it all figured out overnight by any means. I'm still figuring things out. It's an ongoing process.
Yeah.
But yes, take those steps despite the uncomfortable.
Yeah, that's great advice. And it's so true. I think, I was an ICU nurse for part of my nursing career. I can be like kind of type A at times. And initial barrier for me was having that realization of like, I don't have to have it all figured out in order to start, because I'm a perfectionist. Like, I wanted to
Mhm.
have everything figured out. I wanted to know how to already do everything before I started. And
Yes.
you realize, especially if you are doing something entrepreneurial, like, you're never going to have it all figured out. Like, every
Yeah.
single day you are learning something new or trying something new and learning that sometimes that doesn't work. And so you try something else. So I think that that's really great advice. I do just want to rewind to one thing, just in case, listeners are curious about this path in particular. You mentioned functional labs and like different certifications.
Yeah.
Are there specific things required to do what you do? And if so, what are they? And if not, what types of things would you recommend?
Yes. So, as far as the trainings, in the program that I did with the functional nutrition certification, I was alongside people with all sorts of backgrounds, not necessarily a nursing background or even a healthcare professional background, simply people that just wanted to dig deeper and sometimes even just for their own personal health journey wanted to uncover more and learn a new approach with the functional nutrition approach. So, with that being said, with that alone, you certainly do not need anything in terms of quote unquote a resume by any means to do that. More so just an interest and a drive to learn new things and an open mind to that as well. And with the functional lab side of things too, I utilized my RN and NP degree to get set up with functional labs. However, I do not utilize my license actively for that in particular, also because typically insurance doesn't incorporate functional labs as part of it anyways. So this has also allowed me to work. Now I can work with women worldwide, and my license is not a barrier, meaning I'm not restricted to a certain state. And I can still order functional labs. There are a few different companies that I work with. Avexia Diagnostics and Nordic Labs are two. There are a few more as well that I have utilized my license with to get set up. And then I'm still able to, with their support and their practitioners, arrange testing without the restrictions.
That's incredible. I mean, that just opens up so much to you, the whole world.
Truly, yes, it's a beautiful thing. It's incredible.
Yeah, that is incredible. Are you practicing primarily virtually with all of your clients then?
I am solely virtual with all of my clients. Yes.
That's cool. That's also a major switch from nursing and being
Yes.
very much hands-on. But it's really cool that you are able to, have that kind of reach into an audience and be able to help like that many more people. And just the fact that you have the time to really get to know them as a patient, I'm sure allows you to provide incredible care, though it is a digital environment.
Yes, it truly is. And it does certainly differ from that hands-on experience as a nurse. However, a lot of clients will tell me that they really appreciate this virtual support because they don't have to leave their house. I ship them the functional lab test kit to them directly at their own home. They can collect it in the comfort of their own home. They can hop on a Zoom call with me or a phone call, and we can chat through things in their private environment where they feel safe or feel comfortable versus going into a doctor's office, sitting in a waiting room, and it's not necessarily as comfortable of a setting either. So that's a really, really nice piece of it too that is more of a pro.
Well, Rachel, I think that, you shared some information that'll be pretty eye-opening for a lot of nurses listening about building their own business and just like functional health overall. So thanks so much for coming on and chatting with me today.
Thank you so much for having me. And thank you for what you do as well. Your mission's incredible.
If you'd like to connect with Rachel after today's show, you can give her a follow on Instagram at Wholeness and Health, or you can visit her website at wholenessandhealthbyrachel.com. Thanks for tuning in. Don't forget to hit subscribe to keep up with our latest episodes. And if you were inspired by today's conversation, I hope you'll share this episode with someone who'd love it just as much as you did. If you're ready to pivot your path, sign up for my free newsletter at mypivotpath.com. Get non-bedside jobs delivered to your inbox every week. And if you have questions or just want to say hi, feel free to email me at audrey@mypivotpath.com. Thanks for listening, and until next time.